And good afternoon, everyone. Thanks so much for joining us for this Wednesday's COVID-19 press briefing. Today, Mayor Demings will discuss our positivity rates and where we stand here at the county with regards to vaccination. The mayor will also discuss our testing and vaccination locations, along with information as to how to get there with transportation. Orlando Mayor Buddy Dyer could not be here with us today. However, Dr. Raul Pino from the Florida Department of Health in Orange County is here with updates on positivity rates and other important information from the state. Mayor Demings also has an invitation for you all, media members, on Friday, so pay attention. We begin with Mayor Demings. Mayor?
All right, thank you, Dr. Williamson. Thank you to all of you for being here today. In addition to Dr. Raul Pino, we have Orange County Commissioners Maribel Gomez-Cordero and Commissioner Myra Uribe. And we will also, if we have the opportunity to do Hispanic translations, we have Ms. Negron, who is going to be translating for me. Dr. Pino is fluent, so I think that's it for the introductions at this point. And so with that, I know that you have perhaps missed us because it's been 2 weeks since we have done a press briefing, but we missed you as well. So I'm glad to be back today. I trust that everyone had a great Memorial Day weekend while remembering those who gave their lives in service to our country. It is not a cliche, but I'd like to say that we are beginning to see light at the end of this dark tunnel that we have been in for the last year. Dr. Pino confirms that this is the 11th straight day that Orange County's 14-day rolling positivity rate has been at 5% or less. Our latest rolling positivity rate is 4.5%. When we reach 14 consecutive days of 5% or below, we will reach phase 3 under the Orange County executive order, which means that when we reach that pinnacle, all Orange County mandates will be lifted. That means that we would have successfully contained the virus within our community. If all goes well, we may be able to reach phase 3 by Friday, 2 days from now. As far as the vaccination rates go, 55.07% of our county population ages 16 or older has had at least one dose of a vaccine. Sorry about that. That is slightly better than the national average. President Biden announced today that 52% of all Americans have one or more doses of the vaccine. All right, thank you, Dr. Williamson. Thank you, Dr. Pino. I want you to think about that for a moment. 55%. Last year, in order to put this into perspective, at this time last year, no one had been vaccinated. But this year, over 52% of all Americans have been vaccinated, and over 55% of Orange County's population, 16 and older, has had at least one dose of the vaccine. As for the numbers, this is kind of where we are. Since the start of the pandemic, there have been a reported 143,051 COVID-19 cases reported in Orange County. That's a significant number. 1,310 of our residents have died from the coronavirus. I think when we started a year ago, there's no way that we would have thought 1,300 people in our community would die from this virus. So it is important to note that this is still a deadly virus. If you're looking for a free, convenient place to get a COVID-19 shot or get tested for the coronavirus, Barnett Park is a good location. It's open 7 days a week from 9 a.m. to 5 p.m. You can use the drive-through lane, or you can bicycle there if you choose to, or walk up. The site was closed on Monday, but from this past Friday through Sunday, over 3,100 COVID tests were performed and 900 doses of vaccine were administered. Barnett Park offers both the Pfizer and the Johnson & Johnson vaccines. As far as testing is concerned, individuals can choose between either the molecular PCR or the antigen rapid test. You can do both at once if you choose to do so. You do not need an appointment. You can go to ocfl.net/testing or ocfl.net/vaccine for more information. And now I want to talk about our vaccine trailer that has been done in partnership with the Department of Health. The I Got My Shot mobile vaccination trailer will be in several neighborhoods in the city of Orlando and Orange County in the coming days. Starting tomorrow, the trailer will be at Goodwill at Waterford Lakes. On Friday, it will be outside the 7 Bites restaurant. And on Saturday, the trailer will be at Lou Gardens. They will begin in the a.m. For more details, you can go to ocfl.net/IGotMyShot. Now let me share with you some information about free rides. We have mentioned numerous times that vulnerable residents ages 60 and older can call 311 to see if they qualify for a free ride to Barnett Park on access links. But able-bodied residents of all ages now have an opportunity for a free, or I'm going to say low-cost ride to any vaccination location as well. Lyft and Uber are partnering with the White House as part of the ongoing effort to increase vaccine access in our communities. From now through July the 4th, these free rides are low-cost rides. I say that because it's free up to $15 each way. And it has been funded to and from vaccination appointments. So if you live further than it would cost to jump in an Uber or Lyft than $15 one way, you may have to pay the difference. The free rides are intended to help stem the declining pace of immunizations and help the president reach his goal of at least partly inoculating 70% of American adults by July the 4th. As more and more Americans get vaccinated, it results in booming business for the Orange County Convention Center. There will be 14 events at our convention center in June alone. The 3 biggest conventions this month will be Vision Expo. This eyewear convention will generate $23.1 million in local dollars and bring in 9,000 attendees. VMX, the veterinary trade show, will generate $15.4 million and bring in 6,000 attendees. And the AAU Junior Nationals, this volleyball tournament, will generate $177.6 million for our economy, with nearly 139,000 attendees. So speaking of the Orange County Convention Center, I'm happy to note that I will be holding my 3rd annual State of Orange County address at the Linda Chapin Theater in the Convention Center on this Friday beginning at 9 a.m. The event will stream live on Orange TV's YouTube channel and the Orange County Facebook page for anyone to view. Now, we have been through a painful, difficult year, and I will highlight the effects the pandemic has had on Orange County, but we are looking forward to the future. You, the media, are invited, along with others who have been invited and pre-registered. For more information, go to our website at visitocfl.net/SOC, and you will get information about how, if you are not able to attend in person and you want to attend virtually, you can join us live virtually at the Orange County Convention Center. And with that, I'm going to turn it over to Dr. Raul Pino, the Director of the Orange County Department of Health.
Thank you, Mayor. Good afternoon, everyone. Good to be here after 2 weeks, and glad to deliver mostly good news. As the Mayor mentioned, the total number of cases in our county is at 143,051. Our positive rate continues to be at 98, and it will be very difficult to go above that. The county is in very good shape. Our hospitalization has just tremendously decreased. The death rate has decreased, although we have some numbers to report on that here. And also the number of cases has declined in all ages, although younger segment of the population continue to be the highest proportion of the cases, which makes sense as many of the younger population are not eligible for vaccine. And those who are eligible, younger than 18, we would like again to encourage parents and those who are 18 to get vaccinated. The rates are not going as high as we would like to see, and the numbers are very limited, and I will give you some of that later. With regard to the death, as the Mayor mentioned, we are at 1,310, and 22 additional deaths were added since we talked to you last. 9 were female, 13 were male, 9 black, 3 white, 9 other race, ethnicity A Hispanic, 11 non-Hispanic, and 3 were unknown. 14 of those had existing conditions. 8 we don't know. And 2 of the dates are from January of this year, and thus were re-reviewed by the state and assigned to our county. 5 were from April of this April 21, and 15 were from the month of May. 3 of the 22 had an address of an assisted living facility, which is a 14% of those who we are reporting. As the Mayor mentioned to you, the convention center is getting very busy with conference and plenaries, but we really miss it. Our last day was there the May 21st of this year, and just to give you an idea, since December 26th to May 21st, the county and the Orange Health Department provided 280,541 vaccines, and that's a significant number. As the county has closed the Magic Gyms and the convention center also has closed, we want everyone to know that vaccines are readily available to our population across the county, and as far as we can count, we counted 115 pharmacies and other locations that are providing vaccinations in our county. So 115 locations close to you where you can get your vaccine. We are also happy to see an increasing uptake from the Johnson & Johnson vaccine, because it's very good for this phase of the vaccination, which you don't have to have a second dose. With regard to the number of vaccines given in our county so far, the total number is 1,181,9 977 doses has been given in our county. 86,554 were for non-residents. To give you some idea of where we are, people over Orange County that are fully vaccinated, it is about 36.9% of our population. 37% of our population is fully vaccinated. And residents over 65 with complete series, meaning fully vaccinated, is at 76.8%. Now, the number for residents under 18 is only at 16% of those who are under 18. Only 8,169 children under 18 have been fully vaccinated, and that have received more than one dose that are younger than 18 is only 26,443, and we are calculating that that group in our county is over 200,000 people under 18. So we have a long way to go there. And it's critical for the success of the next school year that those who are eligible for vaccine get vaccinated. And as we continue to incorporate ages to continue to increase vaccination rates. For the numbers over 16, the mayor gave it to you, 55.07% of our population over 16 years old have been vaccinated with at least one dose, and that is 645,796 residents. With that, Mayor?
All right, thank you, Dr. Pino. Just as a reminder, Yesenia Negron is here if there are any questions for the Spanish-speaking media. We also have Mr. Scott Howard from Orange County Public Schools here. We've been working in partnership with the school district trying to get teachers and students inoculated as well. So if you have any questions regarding the school district, please address them to him. And we'll open it up now.
It's Steve Hudak from the Orlando Sentinel. Welcome back. We missed you guys. This is actually for Scott. Because of what Dr. Pino just said in regards to the very few youths who have been vaccinated, we're still, and we just ended the school year, but how does that affect your plans to reopen next year?
So one thing is we're starting on making sure that we have vaccinations available for about 23 schools this summer. So we're going to continue to work with Florida Department of Health and our partners at Health Heroes and others to continue to vaccinate. The plans have already, those discussions have already started. They started yesterday. We had a work session with our board, provided input from the Medical Advisory Committee. Dr. Pino was on that call. So we'll be looking moving forward at input from medical professionals that we received yesterday, as well as the public. June 17th, we will have a rule development workshop. We'll look at the proposed mask face covering rule. That's already been, the draft that's out there will be reviewed, and any changes or anything to that would be determined by the board at that time, and then they'll approve that on July 13th or thereabouts. So we'll go through that whole process. We'll start looking at our health and safety manual, what that looks like moving forward. We're obviously working very closely with the Florida Department of Health and with Dr. Pino on guidance and looking at the CDC. They haven't released their guidance for school reopening yet. We'll certainly look at that guidance and take that into consideration. I think a lot of it, we're ahead of that guidance already in some of the things that we've done, and so we'll take that all into consideration. It'll be an ongoing process as we move through the summer, but we're certainly well on our way. Thank you.
If I can add to that, the health department also, for Orange County, received additional funding, about $32 million, that will be solely dedicated to developing a strategy and implement a strategy for routine testing during the next school year. That is in the process to be worked out, how it's going to be done. But it's part of that work that we are preparing to have a successful school year as a student continue to get vaccinated. But for those who are eligible, 12 to 18, they should get vaccinated because it's going to help their peers and the community at large.
Doctor Pino. Pregunta Edgar Carrillo para Telemundo. Primero, quisiera que hiciera ese comentario, por favor, en español para toda la audiencia hispana sobre las pruebas para los alumnos de las escuelas. Y segundo, quisiéramos saber, en vista de que tenemos todavía un gran porcentaje, 44-45% de población que no se ha vacunado, quiero saber si ustedes han hecho un estudio sobre quiénes son, dónde están, en cuáles partes de la ciudad, o qué grupos de edad, o quiénes son los que no se han vacunado.
So the first part of the question was to repeat what I just said in English, in Spanish. So I'm going to say it. El Departamento de Salud ha recibido fondos adicionales del Estado, cerca de 32 millones, para desarrollar un programa de testing en las escuelas para el año próximo, que comienza al final de julio. Y la idea es de tener routine testing en todas las escuelas para aquellos que lo necesiten. Y el objetivo es de tratar de prevenir outbreaks en las escuelas y tratar de contenerlo lo más posible, porque este grupo no está vacunado, especialmente los que son menores de 12 años. Y por eso es tan importante que aquellos que son 12 a 18 se vacunen y se vacunen ahora. So de cuando comienza la escuela están listos, están inmunizados y están protegidos. Y mientras más personas tengamos vacunadas, menores son los chances de que se desarrollen outbreaks en las escuelas. ¿Eso respondió a tu pregunta? Sí. No, we know who has been vaccinated. We don't know who hasn't been vaccinated because we don't run our, and I'm going English, but I will go there. So we don't know who has not been vaccinated. That's very difficult to know because we don't have a control or a list of everyone who live in the county. We know as they get vaccinated who has been vaccinated. By the percentage that we are calculating, so inferring from that is the younger segment of the population, because people over 65 are about 78% vaccinated at least with one dose. So that's an indication that segment. Now, if we go by the pandemic and how the pandemic, what percentage of the population is having the highest number of cases now, it is people who are between 15 to 34. Those are the segment that we have seen the largest number of cases right now. La pregunta fue que si sabíamos quiénes no se habían vacunado y dónde están localizados. No lo sabemos porque no tenemos una lista de todas las personas que viven en el condado, pero sí puedo decir que basado en quién se ha vacunado, podemos decir que el segmento más joven de la población es donde tenemos el mayor número de personas no vacunadas. Y si seguimos donde está la proporción de los casos, el mayor número de casos vienen de gente que está entre la edad de 15 a 34 años. Así que pensamos que es ahí donde está el mayor número de las personas que están autorizadas a ser vacunadas, porque los niños menores de 12 en estos momentos no están.
My question, this is Nikki Zizaza with News 6. My question's for Dr. Pino. Dr. Pino, the county tweeted out that Barnett Park has reached capacity. And hearing that, what are you suspecting could be driving, Barnett Park to be closing soon? Could it be the weekend we've seen, or what are you suspecting?
Well, I think the fact that the convention center is now closed as a large site, and the Magic gyms are also closed. So it was expected, and we expected that the number will increase there as well for testing and vaccines. And that is a great combo to have, because someone who is going to be tested is because they are suspecting that they were exposed or they are concerned, but most likely not vaccinated. So it's a great opportunity to get vaccinated when you are getting tested. At the same time, get free of that concern. You don't have to be tested for the most part if you don't develop any symptoms. And your vaccination, and now they are offering Johnson & Johnson, which again advise people who are healthy and don't have any limitations that look good into that vaccine. It's a very good vaccine, and it's just one dose. It speeds out the process, it speeds out your immunity. It really makes a huge difference.
Sierra Putman with Channel 9. The question, just explain to people, when we hit phase 3, what actually changes?
What actually changes here in terms of the guidance that we have given is that currently on the phase 2, individuals are not required by the county to wear facial coverings while outside or outdoors. And we still recommend that individuals, if they're indoors, socially distance and wear facial coverings. Well, when we reach phase 3, there will be no county-based mandates, requirements for individuals to wear facial coverings while indoors. There still will be CDC guidelines, and daily, if not weekly, we see some updates that come out from time to time. So by the time we hit the pinnacle of having 14 consecutive days of positivity rates of 5% or below, we don't know if at that point where the nation will be and if there will be additional modifications in the CDC guidelines, but there will be no Orange County mandates at that point.
Eric Mock, Spectrum News 13. Question for Dr. Pino and then possibly for Scott Howard as well. I want to hear more about the $32 million you talked about that's going to, where's that money coming from? What exactly what exactly are you looking to do with that in the schools, and how will that help the impact of COVID in the schools? And then if you have anything to add to that, Scott Howard, just about how the district is planning to work with the health department to use those funds to the max.
So those funds come from the state, and the state receive it from the American Recovery Act. They are intended, this one came through the CDC, I'm sorry. This is because we received 2 different pots, one from the state, and this one comes from the state through the CDC. And that one is intended for lab and epidemiological surveillance, as well as routine testing. The idea behind this is also to try to develop a strategy to control and contain future outbreaks that we don't have right now, but that we should expect that could happen in school settings where students, younger than 12 are not eligible for the vaccine yet. So for the next year, and in hopes that the vaccines get approved for younger age in the near future, we have developed a plan. We are in the process right now. I was just meeting before we came here. So it will be premature to talk about what entitled, because it's not solid yet. But what we are proposing, we have to propose to the state, and have to be approved, is to locate health department employees in the schools for at least this coming year of some clinical background, maybe nurses, LPN, or medical assistants, that will be able to help the schools to control future outbreaks. And we'll be able to do the trace investigation and the contact tracing right in the schools. That put a lot of burden into the school system and some principals in the past. We didn't have the resources, now we have it. The idea is also to purchase some rapid testing machines if they are available, because everyone wants it, that we will be able to have it at least in some of the schools, if not in all the schools, so that the test can be rapidly administered and detect anyone who may be symptomatic that have a positive result. So the idea beyond the whole amount is to really expedite results, control outbreaks, and limit the spread of the disease in the next year.
I don't know if there's much more I can add to that. We certainly have been working with the Florida Department of Health in Orange County and Dr. Pino's team all year. Anything we can do to help even improve beyond what we've done in contact tracing, getting information quickly, doing the testing in the schools is welcome. And I mean, certainly we'll work with his team and any plan that they bring forward to make sure that we implement that with fidelity in our schools. So, we look forward to seeing those plans and working with Dr. Pino and his team.
Kelsey Thord with West 2 News. This question's for Mayor Demings. You talked about lifting the mandates for this phase 3. Would you say that once we get into that phase 3 that it's pretty much a sign off by the county that people can go back to living their normal lives as they did pre-pandemic, or,
What I would say is this, is that certainly if you have been vaccinated, there's no reason why you cannot return to some normalcy pre-pandemic once we hit that pinnacle. If you have not been vaccinated, I still would strongly urge and encourage individuals to consider getting vaccinated, because as you've heard Dr. Pino say, based on his medical experience and the research that has been done, getting vaccinated can be beneficial to the individual, to inoculate them from potentially getting the virus and or spreading the virus. So we know that at that point, not everyone in our county who would be eligible to receive the vaccination would have received it. And so we still have some work to do. Remember, the president's goal is that by July the 4th, the goal is to try to get it up to 70% of the American population that's eligible to receive the vaccine. Here within Orange County, there's been a presidential challenge to cities and local communities across the country to try to meet that same threshold that the president has laid out. It will be our desire within Orange County that we too continue to strive to get above the 55% where we are now, to by July 4th, get up to the 70%. So I don't want people to assume that things are totally back to normal, because they will not be at that point. But we're simply trying to give guidance to our community with reasonable benchmarks where people have an idea about what the living experience should be for them within our county. We still will have a number of tourists who will be coming in, who will be visiting in our county, because we'll be in the midst of a very active summer vacation period of time, active tourist period, as well as convention period. You heard me start the press event today speaking about the robust activity that's going to occur at our convention center. And so because of all of that, all of these people coming in from other places, it is still highly recommended that our residents get inoculated. Okay.
Good afternoon, Mayor. I have 3 questions. The first coming for Dr. Pino from Melissa Thomas with the Florida National News. And her question, Dr. Pino, is given the travel rush we'll soon see in the summer, is your team concerned about COVID-19 variants? And if so, what actions will you take if a spike happens in those?
So the second part of the question is difficult because getting vaccinated is the best way to fight the variants or any of these variants that are coming. Our concerns are that a segment of the population that is not vaccinated or not eligible to get vaccinated, because some people are not eligible yet, is the question always remain, how aggressive can these variants be in the future? We have little control how they develop, how quickly they spread. Remember that we learn about these variants as retrospectively We don't know of them in advance. And part of the issue and part of the question is, can a more aggressive variant develop? And what that will do to the segment of the population that is not eligible or have decided not to get vaccinated. Now, the fact that we are above 50%, we are 55, we probably are really around 62, 63%, because again, we are underreporting and we have knowledge that about 5 to 8% could increase when data from the Department of Defense and the Department of Veteran Affairs come into our data sets. And with that, a large segment of the population protected is less likely that something will spread and develop quickly and very quickly. But again, with a small segment, with a segment of the population, let's split it in 50% to go even, that has not been vaccinated, either because they choose not to or because they are not eligible. There is still a significant pool of people that are susceptible to get infected in the future, and that's the concern. And half of our population is about 700,000. So that's a huge number.
The next question is for you, Mayor Demings, coming from WKMG, and the question is, what is your vision for July 4th?
I think on July 4th, we can anticipate a robust amount of activity and tourist visits here within our area. I believe our airport is going to be extremely busy, and I believe that we certainly will be higher in terms of the rate of those who've been vaccinated within our community at that point. So I believe that we will still likely be below the 5% where we would have contained the virus within our community because people are continuing to get inoculated, and that's good news for our community. I believe our economy will be thriving at that point, and we'll be well on our way to recovery.
Very good. Okay, the last question is also for you, Mayor Demings, and it's coming from Ryan Lynch with the Orlando Business Journal. And his question for you is, what kind of planning has happened so far around new federal funds, the American Rescue Plan? Has the county gotten any closer to giving the initial round of funds to residents and businesses?
I will be meeting with the county senior staff, I believe it's tomorrow, and we will have the first look, and I'll be given some direction at that point to fashion a plan, a spending plan that will ultimately be presented to the Board of County Commission for their consideration to be able to continue to respond to the coronavirus, as well as position our community well for the future to deal with whatever the unknowns are. If there are variants or other things that develop, we want to be able to respond very quickly. And we want to also repair some of the damage that has been done to our local businesses, our local economy, and support small businesses, even families. We know that a significant number of families will likely continue to be facing the prospects of eviction. We have primarily through our programs aligned them to provide services and assistance to renters, but we are exploring the potential for also assisting individuals who have mortgages, who are owners, because they too, if they cannot stay in their home, run the risk of potentially being evicted, homeless, and we want to avoid even that. So we have to really look within the constraints of the American Rescue Plan and dollars that are being provided to our local communities, and so we want to program them appropriately so that we get a good return on the investment from those dollars that are going to be put back out into our community. We will work with every business sector of our community to try to help restore them to some sense of normalcy so that we can recover at a much faster pace.
That's all.
Okay. All right. So if there are no other questions, Our next press briefing will be scheduled for Wednesday, June the 9th at 4:30 p.m. However, we will be doing the State of the County on this coming Friday, June the 4th, and at the conclusion of the State of the County, we will entertain some questions at the State of the County. So hopefully we will see many of you there. Those who cannot join us, again, I remind you that there's an opportunity to go to social media, to YouTube and or Facebook Live, and you can follow the live presentation that will be made to report back to our community on just where we are as a county. And so with that, let me just say thank you to Dr. Pino, thank you to our commissioners for being here, thank you to Ms. Negron for being here as well, and this concludes the press briefing today.